Yeah, maybe I will just kick off because the session, this webinar will be moderated by Leith himself, but I would just introduce myself. My name is David Verstokt. I'm from the People's Health Movement, and we are organizing this webinar together with the health work committees from Palestine. So the idea is that we're going to speak about the right to health in the West Bank and about the case of the health work committees. So we have invited Jamile and Mazen, both from health work committees, and also Leith, who is a PHM activist, also from the Birzeit University. And Leith, who will moderate this session. Of course, this is a Palestine session, so the chances are that we're going to get hacked or whatever, bombed, whatever. But let's stay cool and yeah, let's talk about Palestine. Okay.
Yes,
Leith.
we get hacked. Hopefully you will not get bombed.
Hopefully not.
Hopefully not.
Thank you, David. Thank you, PHM team in general for the kind invitation for this webinar. I will be moderating the session, and will also kind of just give a brief introduction as part of that moderation. After that, we'll just be showing a video by and about the health work committees and the rest of the kind of civil society themes that we are witnessing in Palestine at the moment, the repression that civil society is facing, including in health, but also in every other sector. And then we'll hear directly from people who are deeply involved in the health work committees. So this is with Dr. Jamila Aboudohou and Dr. Mazen Rantisi. أهلا وسهلا فيكم. It's an absolute honor to be moderating a session in which people who I've always looked up to are the ones speaking. So this is when I know that I'm doing the right things. So it's really an honor to be here with you and with PHM activists from around the world. So I will just start my introduction by really just framing this conversation about health in Palestine, about we're talking about health under a colonial setting here. So I thought I would maybe just start with offering some insights into the kinds of things that we need to take into consideration here. And the first thing that to always remind ourselves is that colonialism is the kind of power structure that takes over everything, that takes over economic and social production and cultural production and academic production. And so it's really something that permeates through the entire life course of people who are under colonialism. So when just take any topic and you'll find a million different ways to talk about colonialism through it. So when you talk about health, because it's something that's also affected by lots of different things, then colonialism permeates into every single thing to do with health. So I will just to try to be brief, maybe offer a few kind of little case studies of things that we could consider in order to understand the effect of colonialism and what Palestinians have been doing in order to try to combat the effect of colonialism on people's health. And the first is something that is quite simple but quite powerful for me. So, as we probably all understand here, Zionist colonialism of Palestine, which has been going on for most of the last century, is something that first and foremost attempts and has unfortunately largely succeeded in displacing and dispossessing Palestinians. So the vast majority of Palestinians don't live where they are from. They've been displaced from their ancestral villages and towns. In 1948, in the Nakba, Zionist militias succeeded in dispossessing 80% of Palestinians of their homes and expelling them from Palestine. even those who remained were concentrated into ever-shrinking spaces. You know, when we talk about Nasra and Lid and Ramla and Haifa and Yafa and Naqab, the places that Palestinians were able to stay in 1948, the Palestinians were squeezed into ever-shrinking spaces. And Palestinians, started living as refugees all over the world, but particularly neighboring countries, but also as internally displaced people within Palestine, within refugee camps in the West Bank and the Gaza Strip, but also with family and friends in the West Bank and the Gaza Strip. Now, that process continues, right? So when we see what Israel is doing in its genocidal war on Gaza today, we see that the vast majority of the Palestinian population has been displaced. Some of these people have been displaced, 4 or 5 times during the current war itself, let alone before. The vast majority of the Gazan population is actually made up of refugees. And so these are people who were forced to flee their homes in 1948. And then successive wars, war after war, on the Gaza Strip has meant that more and more people have been displaced. And so we've reached a situation where there's this kind of these perpetual cycles of displacement. And that's obviously in addition to all of the destruction, all of the killing, all of the injuries, all of the maiming that Israel is doing in a kind of calculated way in order to try to dispossess Palestinians. So the effects of displacement we see not just with the pain of losing one's home, the kind of psychological effects of that, but also in kind of very physical ways. So being squeezed into ever-shrinking spaces, being cut off from communities, from infrastructure, from clean running water and electricity and all of these various things is obviously detrimental to people's health. And that's why a study on the projection of victims of this current war from the London School of Hygiene and Tropical Medicine are actually projecting. So this is a study, that was quite extensive. Has predicted or projected, sorry, rather than predicted, they've projected that more people will die as a as a result of epidemics if a ceasefire is not immediately reached and basic infrastructure is immediately built and restored. So that's the kind of direct effect. We're talking about people who died. We're not talking about the lifelong impact of siege, of displacement. But there are some hints as to what that might bring. So Area C is a really good case study. Now, the West Bank, which is about 20% of historic Palestine, is chopped up into Area A, B, and C. Area C is 60% of that, so it's 10% of historic Palestine, and it's been largely emptied of its population. So there are only a few 100,000 people left in Area C. Areas A and B constitute the majority of Palestinian towns and cities and villages in the West Bank. And they were meant to be under the governance of the Palestinian Authority, but we see raids and arrests and killing in these areas every single day. Now, Area C is a constant target for displacement because it's where the majority of Israeli settlements are constructed and where the vast majority of natural resources are. And so that's the kind of bit that Israel is always pushing Palestinians out of. And we see that that 16% of the children who live in those areas are stunted, and 23% of children who live in Bedouin areas who face similar kind of struggles are stunted, and 19% of children who have experienced forced displacement, are stunted. Right. This is about double the rate for stunting in Palestine in general. And so, stunting is a really good marker of the well-being of a child, and it's an extreme marker. So if a child is stunted, that means that something kind of drastic has happened. And so, and the other thing to consider is that stunting also leads to lifelong psychological and physical problems, and so that effect of displacement is something that a child will carry with them. So that's the kind of, just a quick kind of snapshot of just how much the effect of colonialism on health permeates through everything. The other thing I'm just going to mention briefly is about the direct attacks on healthcare institutions that Israel carries out with total impunity. And we've seen this for so long. I mean, the World Health Organization has for a few years had this tracker of attacks on healthcare, and that's just around the world. That's not just for Palestine. And the vast majority of attacks on healthcare in the world take place in Palestine by Israeli forces against Palestinian ambulances and clinics and hospitals. And we see that with every single war that's waged on the Gaza Strip, but we see that in everyday life as well. So in terms of everyday life, we see Jenin and Tulkarem in the news a lot at the moment. These are two cities in the West Bank that have refugee camps that are hubs of resistance. They're also the frequent target of Israeli attacks, Israeli raids, almost every single day. And every time that the Israelis invade these towns, the first thing that they do is that they cut off the roads that lead to hospitals. So the Israeli forces go in, they plan to cause destruction, they cause the plan injury, and will immediately cut off the roads that lead to hospitals. And so that's, on the most basic level. In addition to that, obviously, all of the movement restrictions that Israel puts in place also cut off, health providers from each other. So transfers aren't always guaranteed, and frequent delays at checkpoints, which is something that was really reached its kind of peak in 2003. It has come back. So now, Dr. Mazen mentioned he could tell from my name that I'm from Nablus. But I live in Ramallah. But if I want to go to Nablus, I'm frequently having to walk, across these like dirt tracks in order to bypass checkpoints. And that's just to travel 50 kilometers now. And that's something that Israel has instituted for the last 4 months, or almost 5 months in particular. It was always there, but it was kind of been reinforced. And the final thing that I'll talk about, which is something that I think we've probably all seen, is the incessant and systematic targeting and attacks on healthcare institutions in Gaza Strip during the genocidal war, as well as in the West Bank. And so the effect of that is that there are no fully functioning hospitals in the Gaza Strip at the moment. None, zero. There are a few that are partially functional, and partially functional means that they're dealing with multiple mass casualties incidents a day because of the constant bombardment. They don't have the kind of basic infrastructure or the personnel or the equipment or the supplies in order to be able to deal with the number of injured. There are some hospitals that are working at kind of 1,000% their original bed capacity, and that's not something that we can't say that they've actually increased their capacity. No hospital can work at 10 times its capacity and maintain quality service. So the quality of the service has been forced to diminish. We've seen, the vast majority of hospitals in the Gaza Strip face the same kind of technique by the Israeli military as it's made its way through the Gaza Strip. They first warn the hospital that it needs to evacuate, as if that's something that anyone in their right mind could do. Then they fire shots and missiles at the surroundings of the hospital, causing partial damage to the hospital. They then besiege the hospital and then target it directly by shooting, sniping, bombing, and evacuating patients, as well as people who have sought refuge, as well as the healthcare. Over 400 healthcare professionals have been killed directly by the Israeli army in the Gaza Strip, and the vast majority of hospitals have been put out of service completely. When we talk about the Shifa today, it's working to do kind of very basic. It's basically a first aid center more than anything else. It's doing kind of a few other things, but the majority of what it's able to do is kind of quick first aid. And we've already heard from health professionals in the Gaza Strip for several months now, that they're having to choose who lives or dies because there isn't the capacity to save anyone who could be saved. So it's not that doctors in Gaza aren't able to save them, it's that they have been forced not to be able to because they are working under the most extreme circumstances, all of which are manufactured. And that's the final thing to kind of talk about with colonialism, is that it is not a given. It's not this thing that falls from the sky and we can't do anything about. These are structures that are tied to global power structures, to imperial power structures, where there is a choice whether to do that, whether to kind of back them or not. And it's always nice to be among kind of comrades in the People's Health Movement and elsewhere, who don't just blindly accept that that's the way that things need to be, and who are engaged in kind of resisting that. And I think that you know, the video that we'll see in the discussion that we'll have with Dr. Jamil and Dr. Mazen will you know, shed some light on the things that Palestinians are trying to do in order to stand up to these forces that are harming our health on a daily basis. So I think we'll move on to just broadcast a 10-minute video on the shrinking space of civil society and the repression against civil society in Palestine, before then hearing from Dr. Jamile and Dr. Mazen.
في 85 تقريبا 86 بلشت الفكرة من مستشفى المقاصد، مجموعة من الأطباء، والفكرة كانت منها هي العمل التطوعي العام. في المرحلة هذه كان في نقص واضح وشديد، عدد كثير من القرى أصلا لا يوجد فيه خدمات صحية كان.
عندما تتحدث عن لجان العمل الصحي أنت تتحدث عن مؤسسة من أوائل المؤسسات التي أنشئت إلى حد ما بالأرض الفلسطينية المحتلة، وبشكل طوعي. في البداية كان مشوارها مشوار تطوعي، وبالتأكيد من يستفيد من خدمات مثل هذه المؤسسات هم ذوي الاحتياج، الناس اللي بسكنوا في أماكن نائية من جهة، ذوي احتياجات خاصة من جهة، الفقراء من جهة، والفقر كثير في بلادنا.
وصارت الفكرة أقوى في الانتفاضة الأولى لما صار.
Sorry, David, what is it?
Yeah, the thing is that I think there are some people who don't speak Arabic, including me, and we can't read the subtitles because there's like a black square. So if you can like reinitiate, yeah, the film, that would be nice.
I'll try again. You tell me if it's okay. Yeah.
Yeah. And try to move your cursor so people can read the subtitles.
Now?
No, the whole thing is a gray screen now.
If it doesn't work, I can try from here.
Okay, it's not okay. Yeah, you try.
Yeah. I have to be able to share my screen, so Can somebody enable that, please?
Yeah.
Right. Let me give it a shot.
في 85 تقريبا 86 بلشت بالفكرة من مستشفى المقاصد مجموعة من الأطباء، والفكرة كانت منها هي العمل التطوعي العام. في المرحلة هذه كان في نقص واضح وشديد، عدد كثير من القرى أصلا لا يوجد فيه خدمات صحية كان.
عندما تتحدث عن لجان العمل الصحي أنت تتحدث عن مؤسسة من أوائل المؤسسات التي أنشئت إلى حد ما بالأرض الفلسطينية المحتلة، وبشكل طوعي. في البداية كان مشوارها مشوار تطوعي، وبالتأكيد من يستفيد من خدمات مثل هذه المؤسسات هم ذوي الاحتياج، الناس اللي بسكنوا في أماكن نائية من جهة، ذوي احتياجات خاصة من جهة، الفقراء من جهة، والفقر كثير في بلادنا.
وصارت الفكرة أقوى في الانتفاضة الأولى لما صار في عيادات أكثر، صار في كم هائل من المتطوعين. وشوي شوي صار عمل أكثر ترتيب، صار في مجلس إدارة وانتخابات داخلية وأعضاء أكثر، وصلت لحد ما صار عندنا حوالي 50 عيادة أو أكثر في الضفة الغربية وغزة. احنا جزء من استهداف الناس، الشعب الفلسطيني كله. من واقع الحياة اللي بنعيشها تحت الاحتلال كشعب احنا مش مختلفين. يعني لما بدك تسأل ليش تم استهداف كثير من الأشياء في بلادنا، حتى التاريخ استهدف والطبيعة استهدفت والتراث والساندويش والفلافل وال شو ضل مش مستهدف عنا؟ أعتقد هو جزء من تدمير الوجود تاعنا وتشتيتنا.
حتى لو بدي أفترض فرضا إنه الاحتلال يقول إنه هناك أشخاص عندهم أعمال هي مجرد مدموجة بالأوامر العسكرية الإسرائيلية اللي هي يعني بأصلها هي تعسفية، ولكن دعني حتى أساير هذا الرأي وأقول بهذه المسألة. طيب أنت بتعاقب أفراد، ليه تعاقب مؤسسة؟ هذه مؤسسة فيها حوالي 300 موظف. أنت هنا تفرض عقوبة جماعية لا تمس فقط 310 عائلات تم موظفي مؤسسة لجان العمل الصحي، وإنما جمهور واسع جدا يحتاج خدماتها في كل الأماكن في الضفة الغربية يحتاج خدمات هذه المؤسسات. العقوبة الجماعية على هذا النحو هي تشكل جريمة حرب، أكثر من ذلك هي تشكل انتهاك جسيم بموجب اتفاقية جنيف الرابعة. بالتالي حاجة شعبنا هي الأساس في هذا الموضوع. لذلك ما تم ضد لجان العمل الصحي أنا برأيي هو لجم دورها الأساسي الذي تقوم به، وهو دور تعزيز الصمود لشعبنا خصوصا في الأماكن المستهدفة من قبل الاحتلال، التي لا يروق للاحتلال أن أي مؤسسة أن تقوم بهذا الدور.
يعني هم بيعرفوا اصلا ما لنا خاص حتى بالسياسه. احنا عمليا لا نعمل بالسياسه، احنا هيئه او جمعيه مهنيه تشتغل في الطب لتقديم خدمات للشعب الفلسطيني. مش مرغوب هذا الشيء، غير مقبول لدى الاحتلال.
الشيء الآخر، لا يحق لدولة الاحتلال أن تمد قانونها، ما يسمى بقانون مكافحة الإرهاب لعام 2016 القانون الإسرائيلي. لا يحق لقوة الاحتلال أن تمد اختصاصها القضائي وقوانينها على الإقليم المحتل. الضفة الغربية، قطاع غزة بما فيها شرقي القدس، هي أرض فلسطينية محتلة بموجب القانون الدولي. ولذلك مد القانون أنت تتحدث هنا عن ضم رسمي وليس فعلي فقط. وبرأيي هذه مسألة مهمة جدا، وهذه رسالة لكل الشركاء في العالم أن يعودوا يفحصوا كافة الأمور وكافة ادعاءات الاحتلال، حتى بما فيها المواد المقدمة أمام المحاكم، ليروا ليشاهدوا وليطالبوا. وأنا متأكد تماما أنهم سيصلوا إلى النتيجة الواضحة أنه هذا تعسف، وهذا يستهدف رسالة المؤسسة وترهيب العاملين في هذه المؤسسة. يعني شوف، شعوري مؤلم بصراحة. يعني أنا هيك متألم، يعني متضايق من اللي شاهدته واللي بشاهده، إنك أنت أمام مؤسسة كانت عنوان، هي لا زالت في روحها هي عنوان مهم جدا في تقديم الخدمة المطلوبة، في تقديم برامج مختلفة والتفاعل مع المجتمع خصوصا المهمش والبعيد وفي أماكن مستهدفة. اليوم تشعر أنه مقومات المادية غير متوفرة لانطلاقتها لهذه المؤسسة. هذا شيء بزعل بحزن، ولكن في ذات الوقت يعني روح الموظفين والموظفات، روح الإصرار على الاستمرار بالمؤسسة، أنا برأيي هو بحد ذاته درس كبير لازم يستمر، لازم يدعم، ولازم نقف خلفه بقوة.
ولكن الطريق هذا لازم يتكمل. يعني حرام وعيب إنه نتخاذل عملية في هذا الوقت بما توفر، موجود كثير ولا قليل، بدنا نكمل. اللي معانا بده يدعمنا، واللي بحبنا بده يدعمنا، واللي بكرهنا فهو موجود ومعروف، واللي بده يخلي معروف. وهذا قدرنا، احنا جزء من المجتمع، احنا مش جايين من فراغ ولا جايين من برا.
Thank you for sharing this video with us. Really appreciate it. I think that hopefully gives an overview of what the Health Work Committees, who the Health Work Committees are and where they've come from. And I think it's important to note here that the Health Work Committee's presence here in this kind of People's Health Movement webinar is not the product of today. It's something that's been always the case. So the Health Work Committees, in the same way as lots of other Palestinian movements that were established around the middle of the 1980s, were very well integrated in global networks of solidarity. And so I think the attendees list on this webinar includes some people that would have been co-founders along with people from the Health Work Committees of, for example, the International Council for People's Health, which held one of its first gatherings in Palestine, and one of the kind of key kind of things that brought people together around that time was that solidarity internationally, and that out of recognition that people's health is shaped by political circumstances, and colonialism and occupation were two of those things. So I will now hand over to, if you can talk to us for about 15 minutes about the situation of services after the 7th of October. Please, go ahead and unmute and please go ahead whenever you're ready.
I'm ready. Thank you for giving me this opportunity to address you. Can you put in the presentation that I prepared? I'm going to talk about the health services in occupied Palestinian territory, both pre and post October 7th. Pre and post, it's sort of a term that we use, but there is no pre and post in terms of the violation against the health services system in Palestine. The same violation is happening every day. The activity has intensified post-war, but still continuing as we speak. So this is what I've done, is I highlighted the violation against the health services system, pre and post October 11th, October 7th. So can we just move on to the second or the next one? No, the previous one.
This is the second one. This is the third one.
Okay, the third one. This is just to say that the West Bank and Gaza, in contrast to many other conflict areas, is a site of military occupation of civilian areas. When we say military occupation, we have the military inside the area. They're watching you every 24/7, watching every, controlling and watching every movement you do. And it started in 1967, the military occupation, resulting in a healthcare system that are highly fragmented by the occupation itself, by the fact that after Oslo Agreement, the area was fragmented to 3 A, B, and C, and each area has its own government and its own services and ruled by different authority, the Palestinians, the Israelis, and this is caused, it's a part of a strategy that to de-development and deliberately and systematically the deconstruction of the indigenous community, economy, and biodominant power. They dominate the economy, the social services, the health, the life, everything is controlled, and it's a strategy of de-development of the country. Can we go to the next one? Next slide, please. The health services is impacted by many of the Israeli measurements. The first one is the impediment to movement due to checkposts, roadblocks, and requirements for and the requirement for permits. Life said about the roadblocks and checkpoints. The roadblocks is the checkpoint actually is a constant reminder, a constant walls that is put between cities and between villages and whatever they are, checkpoints that are present 24/7 all through the years. Roadblocks, on the other hand, are checkpoints that are implemented on daily basis, implemented at the whims of the military commanders in that area. They put roadblocks when he gets up in the morning, have a fight with his wife, he installed the roadblocks, which means that at checkpoint, you expected that you're gonna pass through checkpoint, but the roadblocks are systematic, are surprised. You will be surprised by roadblocks. Through checkpoints, you can decide to go through different routes and through mountains and through unpaved roads and whatever to avoid the checkpoint. But roadblocks can be put any time that unexpectedly and you can't go through them. The roadblocks and checkpoints obstruct the movement of people and particularly medical personnel and health workers and patients moving from one clinic to another, or patients that need to be transported by ambulances to better health services, to better specialized services rather. So like between January 2007 and April 2008, medical personnel accounted to 929 incidents at checkpoint, resulting in a loss of over 1,100 hours of work. They were detained, 929 incidents that they were detained and at checkpoints, making them lose 11,000 working hours, which means that they weren't able to see patients that need them, see emergency cases, attend to patients of chronic illnesses and chronic diseases. That's in only 1 year. And imagine the cumulative effect of over the years of checkpoints and roadblocks and impediment of movement of staff and of health workers and of patients, how that impacted on the health of the total health of the population. Recently, in 23, the Palestinian Red Crescent documented 11 violations against its medical teams in the West Bank. Ambulance drivers experienced wait up to 3 hours, and many times they were not allowed to access to their patient either entirely. So that's the ambulance services. That's the Red Crescent documenting the violation just only in 2003. That's in 23. That's even before October 7th. This happened before October 7th. They delayed them and violated their movement and delayed reaching the patients, ambulance reaching their patient. And Israeli soldiers delayed or denied medical teams from reaching injured Palestinians 10 times, and on 13th of January, for an example, in Beit Umar, they fired rubber bullets and damaged one of their ambulances. They didn't allow them to reach injured Palestinians. These are injured by being shot by the army, and they require to be transferred to a hospital or whatever. They stopped the ambulance from reaching them. And in fact, they fired on medical teams and ambulances while trying to relieve, to reach their patients. The isolation and fragmentation of healthcare due to the Israeli war impairs provision of 20% of the population in provision of health for the 20% of the population in the West Bank. Can we move to the next page? Because the wall they constructed a wall in the West Bank that cut villages and cities and from each other, and even one village, the separation wall go through the village, and they cut in it to two areas, not allowing one area or one side of the village to move to the other side, which means they cut not only the social cohesion of the village, but also reaching services like education services, health services, and the like. So villagers can't move because of the war. They also, another measure they do, passive closures. What they do, they close an area, they impose a closure. They say, Nablus area is closed now, nobody can move in and out of the city. Ramallah area is closed, nobody can move in and out of the city. They close villages, they close towns, they close communities, and that hinders people from access to primary health care, to hospitals. People can't move out of their location or out of their villages. For example, out of the 47 primary health care facilities in Nablus, 41 were heavily impacted by the closure of the city because staff were unable to reach their places of work. That is in 203. In 23, there is 47 primary healthcare facilities in Nablus only, and 41, because of the continuous closure of the area, their patients were impacted. They couldn't reach the facilities. And people were like people who have appointments for dialysis or chemotherapy or other treatment, they were experiencing delay, and they have to miss their appointments because they couldn't keep up. They couldn't reach the health centers, or the health worker couldn't reach them. The health workers reported 20% drop in patient keeping their appointments for chemotherapy, for dialysis, for life-saving treatment. 20% of the patients weren't able to keep their appointment. And that because they're not reaching their primary health care services, there is an increase in maternal and child mortality and morbidity due to the lack of their services. And there is a growing risk of that. Can we move to the second one, to the third one? Now, the permit regime. To move into the permit regime is installed to limit the Palestinian movement between the West Bank and Jerusalem, particularly, and the 48 region of the West Bank of historical Palestine. So, but a lot of the Palestinian, because there is lots of services not available in the West Bank or in Gaza, so lots of patients are referred to East Jerusalem for treatment, chemotherapy, dialysis, heart patients, orthopedics, they are referred to hospitals in East Jerusalem. And because of the permit, they can't reach their hospitals or the destination they are referred to, because permits take long time to get, or they get delayed on checkpoints and crossings to East Jerusalem, so they don't reach. Lots of deaths that happen on checkpoints or posts, because of military posts, because they reached their posts, but they weren't processed quickly enough for them to reach their services. So that's another way of controlling the movement and controlling the healthcare services delivery to patients. Can we move to the fourth one, which is the patient wall we talked about? Attacks on the health system, we talked about that. Can we move there? Restriction of health services in Area C. As we said, the West Bank is divided to Area B and A, B, and C. C is the most marginalized area communities of the West Bank. The Jordan Valley, south of H2 in Hebron, south of Hebron, the Bedouin areas in Hebron. In Area C, there is a vulnerable communities. They have limited or no access to healthcare because the Palestinian government can't open clinics and provide health services there because it's restricted by the Israeli authorities. And they're not part of the East Jerusalem, so they can't get Israeli health services as such. So they are prevented. They are have no limited or no access to health services. The health services provided by them is by committees like us, the health work committees or the medical relief committees. We through mobile clinics and through setting small primary healthcare centers. And a lot of times these primary like health work committees are prevented from reaching these mobile clinics, reaching these communities and these remote areas, so that they don't get any health services, basically, no preventive, no curative health services. They get it at the whim of the Israelis authority. If they allow the health services to reach them, they get health services. They don't allow them, then they're deprived of all their right to health, as right to survival, right to food, right to air, right to movement. We are restricted from accessing to all these things. To the second one, to the third. Can we move the in the Gaza Strip? There is lots of violation before October 7th. The closure, the blockade imposed on Gaza in 2007, it greatly harmed the Gaza health system, and which had not functioned well wasn't functioning well beforehand because of the lack of medicine, lack of them letting them have equipment, movement of medications, movement of personnel, movement of people to more life-saving treatments, which are not available inside Gaza. They have to move, have to be transferred to either the West Bank or East Jerusalem. And so the permits and that given to patients from Gaza to be transferred to East Jerusalem and or to the West Bank were limited. So the Gaza Strip was under control from the beginning. The health system was deteriorating even before prior to October 7th because of the lack of, as I said, equipment being entered into the Gaza, limited access to medication. They don't allow medicine to enter. They limited the movement of the medical staff and the health movement out of the Gaza Strip for patients. So the health situation in Gaza was dire even before October 7th. Now, if we move to October 7th, can we move to the second? Also, as I said, the lack of medicine and medical equipment to enter into Gaza, and lack of fuels, because fuel, the second one, the effect of lack of fuels. If fuel was limited amount of fuel was entering into Gaza prior to October 7th, and that affected the operation in hospitals because of lack of electricity. At times, the electricity was cut, and so that affects patients and newly born kids in incubators, surgery, and all of this. So that was part of the effect of the fuel reduction in Gaza. Can we move into on the October 7th?
Next one.
Next one.
Okay, fuel. Yeah, okay.
That's, yes. This is attacks on the West Bank post October 7th. This is the latest WHO data highlighted the growing number of attacks on the healthcare in the occupied West Bank post October 7th. There was at least 364 attacks on healthcare happened in the West Bank, resulting in 10 fatalities and 62 injuries. They were attacking the healthcare, the hospitals, and the hospital and primary healthcare centers. They enter the hospitals and they injure or kill or throw tear gas and suffocate lots of patients and lots of medical staff in there. So there was a 364 attacks on healthcare. Like Mr. Jazaviric said, who is the spokesperson for the United Nations, that 44 health facilities has been affected, including 15 clinics and 24 ambulances. When he says affected, that means they've been attacked, there've been damages, there've been closure of these health facilities, ambulances been attacked and damaged at some point. So these are the kind of attacks that happening on health facilities. Like, for instance, in the last few weeks, Israeli forces besieged many hospitals in Jenin. Like, for instance, they were in Jenin, they killed 3 patients in Jenin governmental hospital. A special unit entered the hospital. They were dressed in medical personnel gear and some in women's gear and cleaning gears and whatever. So they entered the hospital and killed 3 patients. Two patients and one accompanied his brother. They killed them as they were leaving the hospital. The special unit, they were discovered that they were a special unit and they were a suicidal unit. So the staff and the people try to stop them or try to attack them, and they start firing machine guns at the people in the hospital. That's in Jenin alone. And even in Jenin, they also killed another boy in Slimans hospital. They killed another boy. They attacked health personnel. They attacked many of the hospital, Ibn Sina's hospital, by tear gas and by every means they have. And they fired shots at medical personnel and at emergency doctors and people in the emergency room. So that's what's happening in the last few weeks. For example, the Red Crescent documented a total of 180 incidents against ambulance. ranging from prohibiting them from going access the area where is the injured and the restricted area. You know, when they see Jenin camp, for instance, refugee camps, or Tulkarm refugee camps, or Balatan refugee camps, or any refugee camps, or in any city or any town, there is a siege. They close the area, and they will not allow ambulances to enter into the area to evacuate injured or even killed youth and whatever. They kill them and they leave them on the floor bleeding till death. So that's what's happening. They're not allowing ambulances to reach them. And they also, for instance, they attack the hospital, the ambulances, and they enter they open the ambulances and they attack the injured in the ambulances, leading to killing of 4 people in the ambulances. So that's what's happening in the West Bank, and it's continuing as we speak. There's more of attacks happening in the West Bank on the health system. In Gaza, can we move into the Gaza? No, I'm not elaborating so much on Gaza post October 7th, simply because we watch it. Attacks is still going on as we speak now. Like Al-Abda Hospital, which was attacked 3 times. Today, it was attacked and it was out of service. Just today, it was out of service. They destroy it completely and render it out of service. In Abda, for instance, there was 3 doctors killed, 2 nurses were killed. The director of the hospital, Dr. Ahmed Mhanna, has been arrested and we don't know where he is. No news about him and where he's been held. So this is what's happening. But I'm highlighting the first few days after October 7th. Like in October 15, there was 48 attacks on health clinics and facilities only in the 8 days since October 7th. And there was 24 hospitals were damaged during only during the first few days. And during that, there was 320 people, including 16 medical personnel being killed, and 307 attacks on healthcare facilities in Gaza as of November 15. In February 7th, for instance, that UN stated that only 4 of the 22 health facilities that owned by UN still remained in operational. Like hospitals. The first hospital to be attacked, Al Ahli Hospital. And you know what happened in Al Ahli and how many were killed. Then the Shifa compound. The Shifa compound, they arrested the director. They killed it was 8,000 people sheltering there. They decided there was people in the incubator. They evacuated the people, the kids and babies in the incubator. They evacuated few of them, and the rest were left in the hospital. They bombarded the hospitals. I mean, it's not only the Shifa, not only the Ahli or Rantisi, the Indonesian hospital, Al Aude, Kamal Ridwan. Most of the hospitals in the north were attacked or damaged or bombarded or evacuated by army orders. As we speak, there is only Shifa hospitals operating in the north, which giving just first aid to some of the patients. Kamal Ridwan, for instance, today it was destroyed and it was completely out of operation. In the south, every other, like they attack the Nasser compound and it's out of service. Most of the hospitals are out of service, south and north, in the south and in the north, because of the lack of fuels. Basically, most of them are out of operation. What else? As of 14th of November of last year, only one hospital was still operating in Gaza. In November 24, 30 of the 60 hospital in Gaza has been bombarded, even while medical staff and patient and civilian seeking shelter remained in the hospital. They bombed everybody there in the hospital, medical staff, patients, equipment, people, kids, infants in incubators. I can't say more, or I can't say more if you want. Can we move to the second? Can we move to the second? Okay. After I've said what I've said, I mean, this is how many health workers been impacted, and just move to the last
page.
To the last page. Now, before we talk about this, let's illustrate stress. I want to stress one more. The attacks on health services prior or post October 7th still continuing. They're still impacted. The movement is restricted. Closure. The wall still there. The attacks on ambulances still there. The attacks on health services still there. Hospitals being attacked. Ambulances, patients, doctors, medical staff. Everybody is still being attacked more severely, granted, after 7 October, but the measures still in place and still going on and will continue to go on till the occupation is there. Until the occupation is ended, the suffering will not end. And so the way to move forward, we know that war and political violence is a fundamental public health problem, and regarding its prevention as a central task of the health professional is thus essential. There is a need for an external pressure on the Israeli occupation to end its hostility and its attack on health services and on the Palestinian as a whole, to stop the war and stop this madness and this killing that's going on. Accountability and adherence to international convention, such as the 1949 Geneva Convention, is a step toward saving lives. We have to put pressure on Israel to abide by the international laws and convention at least, and it should be held accountable in the International High Court of Justice or in the International Court of Criminal Court. There's got to be a movement to hold Israel accountable for all its action against Palestinians. As well as said, international convention and strategy is important for health in the interim period. However, there can't be a substitution for the right of self-determination and the right of Palestinians for freedom and self-determination and to be free from the occupation and in the occupation. There is no other solution for us to maintain our right to health, our right to life, our right to education, our right for survival and living like every other people on the face of earth. So in the occupation, and this is the only way to move forward. That's it.
Thank you so much, Dr. Jamila. Really appreciate the insights and the comprehensive coverage of the health situation. We'll move on quickly to Dr. Mazen. يعطيكم العافية. We'll try to leave, if possible, time for questions at the end. But Dr. Mazen, I'll leave the floor to you to speak about the role and the future of the health work committees. You've got the floor.
Thank you. Okay, I'll try to be as brief as possible. Our previous role and our coming role actually are not importantly different. We remember that since our starting, we see our role in our society, in the Palestinian society, as elevating the pain and the suffering of our people first, and to enhance the people's standstill, to keep resilience in Palestine, because the occupation actually target to make life more and more impossible for Palestinians. And our role is a combination of humanitarian and patriotic, let's say. It's a combination of being with the people and trying to give the medical and health services to the people as much as we can, especially those who are more deprived economically and socially and in all aspects. It will not change, but what you are facing lately is more harsh and more aggressive measurements against us. I don't want to keep repeating what our colleagues know for sure, but lately all these obstacles were more intense. We had been facing the financial and the administrative problems, and we noticed that since last year, or since the last years after we've been targeted by the military authority and the closure of our offices and putting us in the blacklist or the terrorist list. Many of our supporters, or those who used to give aid for us in international arena, are afraid, and they cut their financial aid to us. Of course, this has historically been a problem, but lately it's becoming worse and worse. The banks and our banks' transfers have been repeatedly interrupted, and more obstacles were put in front of us. Maybe our colleagues can tell you about it, as we face lately with transfers from abroad for our projects. As you know, our employee number dropped from 300 and something to about 100 now. We were forced to diminish our administrative and our employee number. And this reflects itself by more problems and more difficulties. Especially, we have a huge debt, which we are not able even to cover, and even things are becoming more and more hard. We need also to renovate many of our old medical equipment, which is also a problematic issue. But to solve these problems, we are having few options. Sadly, we were forced to sell some of our assets. We sold a couple of cars to and able to be able to pay the employees at the end of the month. And we are thinking now, we're trying to sell the offices which were closed by the occupation to try to provide some money for to pay our suppliers, the medical suppliers. But nevertheless, we are managing also, although with a lot of difficulties, we are still managing. We put some emergency measures. We try to reduce our cost, the running costs, as much as we can. Sadly, we closed some of our services, such as we had in Jerusalem school program. We used to have school program in Jerusalem. Last year we closed it. And the last few months we were forced to close also some of the Jordan Valley clinics, which is bad. We are feeling really sad for this. But besides the economical situation, also the movement and the obstacles of movement and going and coming to these clinics became increasingly risky and difficult and complicated. In the internal arena, we can talk about the bureaucracy of the PA toward us, which actually another issue which we are facing with them, like making it every time harder to get the license for our laboratories and our centers, which is a very sad story also. Another situation we are facing on another sad story also is some of the previous employees are suing us, lawsuits to get the money. We are trying to make arrangements to pay it partially, monthly, on a monthly basis, and to cover this problem. But all of these issues together create a kind of chaos, a kind of chaos, whatever. And most of our time is lost to solve daily problems on this base, which the core of it, the main source, the main problem is economically, actually, economic problems. With that, they try to suffocate our efforts and our income. And we're trying to find other ways. This is in general the situation, but nevertheless, we're determined to continue. And I can assure you that we will continue because whatever happened, I think we are part of our people, and we will continue to support them as they continue also to support us. That's what I want to say.
Can I add?
Thank you.
Can I
Yeah,
add?
of course, please go ahead.
One of our main issue, or what we're facing, is a result of the occupation closing down our offices and attacking us and making it difficult for us to operate, and arresting some of our staff and helping us closing some of our centers. So that's put us in a financial hole, if you like, that we're trying to climb out of it by all means that we possibly could, by reducing the services, which is sad because the population, our people, need the services, particularly in the Jordan Valley, in areas where the remote area and marginalized and the poor, and this is where we service. So it's very sad story, but that's the story of our population, of our people. The story of our people, we can't keep our head above water because we're always attacked by the occupation authorities and by stopping us from breathing. They control everything, the air, the sea, the movement, everything. Thank you.
Thank you. Thank you so much. It's really an honor to as I said before, to be in conversation with you. I'm going to start with a question to both of you, actually, if either of you want to answer, or both of you, Dr. Mazen and Dr. Jamile. I want to ask, since we are here in a space hosted by the People's Health Movement, can you tell us what you've experienced as these international partnerships with organizations like the People's Health Movement or the various affiliates and Viva Salud and various colleagues from kind of Philippines and Nicaragua, etc. So what's the effect that the exchange of ideas and resources and the conversations that you have internationally, how does that reflect the work that the Health Work Committee is able to do?
Great. It's a very important question, I think. Just to start with, as you know, our organization had never accepted since 35, 40 years since we started, we never expected any conditional tamwil and funding. And this is a principle with us. We never accepted from our enemies, let's say, because we know that it's a conditional funding. And we are proud to keep our international relations with people who are really supporters of us. And we insist to keep our work on this base. And we have been always supported by them, and tell you the truth, it's crucial. It's very important. Without their help, maybe we wouldn't be able to continue in many aspects. Although we are trying lately, because of the crises, we are trying to be more self-depending, but it's impossible to to provide this kind of services, which we are doing now, still trying to continue with, without their support. Viva Salud and our colleagues, the Catalan communities and the Basque community, and all these people, although we know that they are facing also their own difficulties, but they never stop to support us materially and morally also. Their moral support is really appreciable. And even technical support, by on daily basis, they support us with reports, with advices, with webinar like now we're doing, and many other things. So we feel ourselves part of an international community, actually. The struggle of our people is part of international struggle for humanity as a whole. And we are proud of relation with them. We feel them colleagues and comrades, compañeros, and hope that we will continue together.
I'd like to add, People's Health Movement, Viva Salud, and people that Mazen mentioned, their support, moral support, and solidarity, and whatever is very crucial and important in our struggle, because our struggle is a political struggle, whether we like it or not. We're struggling for our freedom, to be free from the occupation, by trying to help our population, our people, to become more resilient and defend their rights to health, to education, to survival, their right to freedom and whatever. Their moral support is very crucial at this point. However, I must add, their funding is crucial to continue our work. The funding that we get help us to do some crucial work with our communities, providing services. We're providing services for the disabled. We're providing services for women victims of violence. We provide services for children, maternal health and dental health, and we're hoping to get some support to reoperate our cancer clinic, mobile cancer clinic. So all of these is very, very crucial for our work and to continue our work. Thank you.
Thank you so much to both of you. I will, so David, I think you have a question, so you can unmute yourself. And as Deepika said, if anyone wants to ask a question, you can raise your hand as well. I didn't realize that you can also raise your hand and we can ask you to unmute. So you've got that 3 different options for asking a question. The opportunities are limitless. So David.
Yeah. So maybe I just like 2 points, because what Mazen and Jamili told is like, it's first of all about the bank transfer thing, because we spoke about colonization and whatever. I think that's very problematic, because what's been happening the last couple of years, but since the 7th of October, things got much more difficult, is you have intermediary banks. For some reason, we still have to use this. Nobody understands, because it's all algorithms or whatever. We still have to use intermediary banks, and often these are in Germany, in Switzerland, and whatever, and they block the transfers. They block the wire transfers with no right. They do it, and they just do it because supposedly they're apolitical. They're not a political institution. They're just banks. But in the end, they do it because they're afraid. For example, if HWC is called a terrorist organization and there's some kind of terrorist law in your country, banks can get sued for transferring money to HWC. So if Israel, for no reason, with no justification, with no basis, just says they are terrorists, they are manipulating the international transfer system and the bank system. So they can say they're apolitical, but they're not. So this is the first thing. And the second thing, I think what is very important here with the story of HWC and what Mazen also told is like, what Israel is doing, they're not killing the organizations. They are not telling you you cannot exist. But what they are doing is they're creating the circumstances, for example, that European donors like the Swedes, the Swiss, they run away. Because who wants to support a terrorist organization? So they just kill you slowly. They let you bleed dry, and that's what's happening. I'm surprised to hear, for example, from 300 to 100 employees at health work committees, this has a huge impact on right to health. It's like 2 things that I want to maybe emphasize, that it's really like trying to kill them. But yeah, okay. That's
Yeah, David. I mean, you're right. I mean, that use of, it's essentially using bureaucracy as a tool for oppression, right? I mean, that's kind of what it is. It's kind of always wrapped up in that kind of technical and good governance language, but it is unfortunately very effective. So yeah, I mean, and these are the kinds of tools that have been created over time in order to kind of almost outsource that kind of repression. I mean, in the 1980s, activists from various groups would just kind of collect money in their home country and then go and use that in solidarity with the movements that they wanted to support. And when and obviously all of these structures have been used in a kind of very hegemonic way in order to crack down and really kind of only allow a particular path. And yeah, exactly as you say. I mean, all the European countries came out and said there's no evidence of the Israeli claims, but we're still going to stop the funding, right? That was it, and they keep saying it. They keep saying that we're still waiting for the Israeli intelligence services to provide evidence, and they still don't, but they're still not restoring the funding. I mean, they said at one point that they are, but it's an absolutely minuscule amount that they've restored, and so it's really these things are so insidious in the way that they are used as tools for repression. We'll move on to a question from the audience. So Brunel de Souza, thank you for your question. Brunel is asking, what message do you have for students of public health? So I'll again give the floor to you, Jamila and Mazen. Any advice, any wisdom to share, any demands that you would make of students of public health?
Okay. since we are part, as I said, part of an international movement, I consider that we are part of an international movement.
Yeah, too well.
We think that all our supporters have the right and the obligation, maybe, to understand more and more about all the details of our cause. And this is partially also our responsibility to keep in touch with them. Because lately, and it's an opportunity after this big solidarity in the world toward our cause, people start being more aware of the Palestinian cause. And people start to relate things together. The occupation, the health situation, and the economical situation, all of them together, they are related to something bigger, which is the domination of capitalism and the hegemony, الهيمنة
Hegemony, yeah.
of United States, of all over the economy and the military and the destiny of humanity. And I see things in this aspect, that these people who are in support of our cause and support of our organization are part of this. So the medical students or the health students are actually part of it, since they represent also the new generation, which is more aware of political details and more aware of the relations between economy, health, and politics. So I wish that day by day, with the time, the conscious of the global conscious, in the world will be more supportive of us, and we also, on our part, supportive of them, because it's a two-way relation. Now, I'm proud to say that we start receiving many connections with people from Latin America, for instance. And thanks for David, who connected us to movements and colleagues, compañeros, camaradas in Latin America, in Bolivia, Chile, Brazil, and etc., who start asking and telling and their side of the story and our side of the story, which belongs to the same core. Ça va? That's what I wanted to say.
I suppose for public health students or health students, I think they should study more and read the history of any cause, not our cause only, but for any cause, not to listen to the media, what they say. Just educate yourself about the cause, if we talk about the right of health of any indigenous population, any population around the world, we should study their history and their culture and their aspiration, and educate ourselves about what's going on around the world, and talk about the right of health. Then we can give them the right to health, and we can encourage people to live a healthy life, I suppose.
Yeah, completely. Completely echo exactly what you said, and that kind of interconnectedness of these issues is really crucial to thinking about, the systems that either cause good health or ill health. I think if there are no more questions, I will maybe just offer brief words of a wrap up. And just to say that, I think if we take anything away from the various things that you may have heard today, the thing to really take with you is just that recognition that when we're talking about any sector, and health is no different, we really should be thinking about the various kind of power structures that determine it, the various power structures that enable good health, and the various power structures that cause ill health. And colonialism, occupation, capitalism, all of these kind of big structures that try to seep in to every aspect of our lives will invariably affect our health. And so, one of the good things that we see in the kind of work that we do within the People's Health Movement is that we don't just think about individual issues. We don't think about maternal and child health by itself, and then we go and talk about vaccines. And we don't do that. We talk about health as this thing that's constructed through all the various economic and social and political systems. And so when you talk about Palestine, it's the same. When you talk about health anywhere, it's the same. Just don't let these kind of hegemonic ideas overpower you. Don't let them make you think of only these narrow definitions of health. Health and well-being, psychological, spiritual, physical, are all sides of one coin, and that's the thing to always bear in mind. And that's how we build connections between different causes as well. That's how the People's Health Movement has been able to bring together movements to health from Palestine, as well as the Philippines and India and the UK and Belgium and Nicaragua and lots of different other countries. And so that's the final thought I'll try to leave you with, is build these connections by recognizing the interconnectedness of the determinants of health, and that's how we build solidarity. So thank you so much for attending this webinar. Thank you so much for Deepika and David for putting this together and inviting us. Thank you in particular to Dr. Mazen and Dr. Jamila, both people who I've enjoyed hearing from, and hope to see people in future discussions and actions as well.
Thank you.
Thank you very much for David and for everybody who was involved in this, and Deepika in being involved in this and setting this up. It was very important for us to talk about our cause and about our struggles, our daily struggles, and not our only as an organization, but a part of the larger struggle of the Palestinian community and what's going on in the world. So thank you very much for giving us this opportunity.
I want really to thank everybody, David especially, and Deepika.
Yeah, thank you very much, Mazen.
Nice, everybody. And I want to tell you some small thing that you boost our spirit. Seeing you and talking to you and seeing how much you support us with enthusiasm and real solidarity boosts our spirit, and it helps us to fight this depressing situation, which we hope that will be ended. Because our struggle with you in India, in Latin America, in Philippines, in Asia, in Africa, it's one struggle, and the enemy is one. The enemy is one. And we hope that although our cause now is in the front line of the fight and struggle anti colonialism, but we appreciate also your effort, and it's not less important than our efforts. Thank you from our hearts. Thank you.
Yeah. Thanks, Mazen. Thanks, Jamila. All right. Okay, bye-bye. Yeah. We'll
Thank
share
you.
the recording. Yeah, bye.
Okay.